Amazon is going back to a 5-day working week. I wonder, does Amazon actually understand what's going to happen next? Do you know what's going to happen next? Do you have this kind of idea that the pandemic is behind us and we just move on with life as normal? Well, one of us is wrong, and it's not going to be me because I can tell you what's going to happen next because I've been accurately predicting it now for 4 years. If you're not aware, I've always said that this is not a typical disease. It's following a very different pattern to any other respiratory virus that we have ever seen. And actually, I don't even call COVID a respiratory virus. It's more like a vascular disease with autoimmunity. It's a very complex condition and it's having big impacts on companies. Now, the problem is that everyone wants to get back to normal. And there's a real issue with regards to productivity. Now, yeah, you just have to talk to business owners for them to moan about the fact that when people are working from home, they are not as productive. I think that's just realistic. They may put in more hours, but they're not necessarily going to be as productive. Now, this is not the case for everyone. It's just what I hear business owners complaining about. Additionally, they have a problem with the fact that the culture of the organization can't be developed if everybody's in a different location. And added on to that, I recently heard some figures coming out of the UK in terms of office space utilization. It's about 35%. And when you think of office utilization, even in a big city like London, it's just over 50%. So these are really huge numbers that are having an impact. So, what is it that is coming out from Amazon that would be relevant to what may be happening for every workplace? They're just going first. So, this is from The Guardian, and this was published just in the past day or two. And what they're doing is that Amazon is mandating 5 days a week in office starting next year. First thing is that they haven't tried to take it on immediately. They're giving some employees some time to think about it. So Andy Jassy said that in a note to employees that the new requirement will strengthen our culture. As I said, he is reflecting what many other business owners are thinking, that they want their staff back in work. And as I said before, I don't have an issue with the premise, but I just think to myself, maybe they don't quite know what's going on or what the trajectory of disease is. So you have to remember that COVID is still circulating very highly. Now, even though nobody's talking about it, it doesn't mean it's not circulating. And you may think, well, it's only causing mild disease. So what's the big deal? Let's just move on. So I am sharing with you what I've been talking about for the longest while, which is COVID storm. And this is what I'm likely to be sharing quite shortly, just to help people to get an understanding of what I'm looking out for. Even though symptoms are mild up here, it's just the tip of the iceberg because underneath the water, this is the immune activation that occurs. And it has a whole bunch of things that go along with it that don't all present immediately. This is where it gets very complex because all people seem to be interested is in this bit. But for employers, this whole thing here is now extremely serious and something that they should be very worried about. But they're not being given any advice. They're just being left to their own devices to go on as normal. This was so important that what I put together just recently is that I put together a presentation that I was trying to get. Well, I'm planning to give to companies because I'm thinking they really have no idea what's going to happen next. They need to be prepared for it. And this is the kind of information that I was looking at sharing. And if you want this, you'll have to look at the link for Substack. If you work in an organization and you're in health and safety, you definitely need to read this. If you need to pass this on to your health and safety person, you definitely need to look at this. Now, long COVID we know about already, But COVID storm is my concept. Spike triggered autoimmune response mechanism. But what it is about repeated exposure to the spike protein triggering this overlap of conditions. On one side, you have the long COVID, and on the other side, you have the COVID storm. This is where the more serious conditions can kick in. And if you don't understand it and don't anticipate it, it's going to catch you out. These are the numbers we're talking about. 19% of adults in Canada have long term symptoms after COVID. Now, this number is likely to rise and overlap with COVID storm in the next few months because we have a new variant going on. And I say this is just the facts. If you've got COVID circulating in a population that is unable to neutralize the virus, and this is seeming to happen in highly vaccinated populations, this is a risk to everybody. And in my view, this is what it looks like. I've shared this before, but I'll have to keep on sharing it. That's the COVID storm. The two epochs on one side, the infection, and then on the other side, the recurrent, you could say, spike triggered situation causing this storm situation. This is what I anticipate is already happening. It's just that employers have no idea what is going on. They just think that, employees can't be bothered. The problem for employees is they can't tell the employers, because if they tell the employers they're not feeling well, that could be a risk in some jobs. Then they could be on long-term sick. The numbers that we're talking about in terms of cost to companies are huge, and they really, really need to be understood. Now, the issue is that when we look at it, and I'm taking here another article here. This one here is from USA Today Money, and it's saying the same thing. Amazon CEO Andy Jassy announced on Monday that all corporate employees will return to work full time starting early next year. And they have already recognized that, in effect, when they tried this before, it had an impact on the employee retention. I think this is lower down, that they talked about the fact that employees didn't want to get back into work in the normal way. And this is therefore causing employees, therefore, not to want to stay with Amazon. And this is the bit I was trying to look at here. This is employees have walked out before. So a group of Amazon corporate employees raised issues with the mandate last year, staging a walkout in Seattle. So employees are not happy about getting back into work. And the reason why I'm highlighting this timing issue is because I think that Amazon is under the impression that COVID is over. Maybe if you're in Africa, it's over. Not if you're in the Western world. This thing is still circulating avidly. And don't let the fact that nobody's talking about it lull you into thinking that there is no issues. If you don't believe me, what you must do is look at hospital statistics. I've shown this recently. Certainly in the UK, the hospitals are overwhelmed in the summer. It's the same thing is going to be happening in the US, in Australia, in New Zealand, in Canada, across Europe, because people are getting sick. And that's the principle of the storm. The storm is not about an acute lung presentation. That's what we saw in the first phase of the pandemic. This is a different beast. This one presents oftentimes silently. And this is why I'm so concerned, because people will just feel unwell, not quite right. And they sit on this for 3 to 6 months. And then they have that big heart attack or stroke, or some strange cancer comes up, because nobody's taken into consideration this immune activation. Listen, if nobody is listening and you are listening, you need to be prepared. And this is why I'm very happy to tell you that we have funded our Kickstarter, because I knew this was such an important thing. Are you prepared against disease X? Now, when I talk about disease X, I'm still talking about COVID, because I think that this is what is our big challenge now. And so we have done this. We are doing this book, I should say. Are you prepared? Because if your employers aren't bothering and public health is not telling you anything, what do you do? How do you prepare? That's what we're focused on. It's 16 chapters, so it's a lot of information, scientific insights, and so on, and 16 in depth chapters. We want to get this to number one on Amazon. So, what we want you to do is, if you haven't yet subscribed to the Kickstarter, please put in your email. You'll also subscribe to our newsletter, and you'll be put on the pre-order waiting list. That way, what will happen is that when we launch the launch it on Amazon, we will let you know, because that's when we want you to purchase it, so that you help us to go up the rankings. That's really what it's about. It'll be about a month from now, but we need as many people as possible to get on that waiting list, because you will need this information. And this is the point. Nobody is talking about the fact that we are having high circulation of COVID at the moment. It seems to be a point that is being missed. Don't underestimate this. This is pretty serious. Again, let me just show you what it looks like. Just remember the principles. If you have a situation where you have recurring COVID infection occurring in high either immune priming, even from prior infection or from vaccination, and this keeps on happening, this storm is likely to be brewing. It's not everybody, but the probability is that the numbers are significantly up as we go through this next circulation of virus. For me, it's a critical thing. Every day I am using my strategy, and this is what I want to share with you. Follow the simple things. This is nothing that you need to get prescribed for, but these are things you will have to get. But critically, I believe in education that you must understand why it is you are taking what you're taking, and you must be able to pass that information on to others. We're in a time now where the public will need to educate everyone else, because at the moment the scientific community is a bit lost with what is happening now and what to do. The only option they have at the moment, it seems, is to have more booster vaccines. For some people, that may be relevant. I don't exclude the possibility that it can't be helpful in some cohorts who are at high risk of severe disease and immune responses. However, there may be better ways to address it. And if you are not on that train line, you definitely need to have strategies that will help you to cope with this. So, as usual, if you want access to the PDF that I said, and what you do with the PDF is that this is for people who are, I'll show you again just before we finish. If you are in an organization, health and safety, or if you're a senior person in an organization, you need this document. Just look at it. You need to risk assess it and consider what impact it could have on employees. If you are working in a company, what you should do is still get this document, pass it on to health and safety. They need to consider the impact of what is likely to happen over the next few months so they can risk mitigate how to deal with employees. It's relevant to everybody. Everyone has a role. And if you are listening to this, you have a responsibility, because you are now probably far more educated than everyone else. You have a responsibility to disseminate information that is valuable. Look in the description below for all the links that are relevant. And remember to subscribe. And we look forward to sharing valuable information with you in the near future. Have a great evening.